Hello everyone, my name is Boris Karaman. This video is filmed from nursing class 4030 at Capella University, and it is about making evidence-based decisions. I would like to thank Dr. Food for teaching us in this course about how to apply available evidence in the process of clinical reasoning and judgment, which leads to interventions that result in desired patient, systems, and population outcomes. Background story. The scenario of the Villa Health media describes clinicians from a variety of care settings who collaborate in managing care of a pediatric patient, Caitlin. Caitlin is a 2-year-old girl who was admitted to Valley City Regional Hospital with a diagnosis of pneumonia. After performing numerous health tests, including sodium chloride, which is a sweat testing, Caitlin was assigned a diagnosis of cystic fibrosis. The pediatrician of the Valley City Regional Hospital, Erica Copeland, is leading the case of this child to ensure proper interventions are in place by involving other skilled clinicians into Caitlin's care. The Valley City Regional Hospital's team includes nurse Virginia Anderson, respiratory therapist Rebecca Helgo, and social worker Martha Simmons. The other remote care professionals in McHenrytown are Caitlin's primary pediatrician, Dr. Walter Benjamin, and family social worker, Madeline Becker. In this scenario, the interaction between the two distant teams illustrates an example of remote collaboration since patient's family lives in a rural area far away from major hospitals. The care team manages to use Skype technology, texting, and phone calls to exchange information between all healthcare providers located in different places who are taking care of the child and her family remotely, with the inclusion of her mother, Janice Bergen. Proposal of evidence-based care plan to improve the safety and outcomes for the patient. In order to establish the correct plan of care for Caitlin, Dr. Copeland ensures that the diagnosis is accurate by collaborating with her primary nurse and a respiratory therapist, as well as outlining the goals of care. The three clinicians come up with a treatment plan that is evidence-based with a focus on specific patient needs that are targeting cystic fibrosis. As there is no cure for cystic fibrosis, via remote collaboration, the team goes for the alleviation of the symptoms and reduction of complications of the disease. The Villa Health scenario describes the evidence that is relevant to Caitlin's case, which is individualized, very specific care according to her young age, family concerns of financial tightness, difficult access to health care due to remoteness, as well as strengthening the skilled knowledge of all involved clinicians to provide safe and prompt care. The Villa Health situation could be represented through the application of the Johns Hopkins evidence-based practice model. Dr. Copeland and Caitlin's care team adopt the model's process that is reasoned to touch upon three aspects of this patient's needs. The steps are recognizing the issue, recommendation of evidence, and translating it into creation of action plan for Caitlin's care. The Johns Hopkins model offers easy-to-use tools to help the healthcare providers in caring for patients in a systematic manner. In addition, the evidence-based practice model calls for the use of the most recent research findings and their inclusion in the management of care accordingly. In the scenario of the Villa Health, it is represented through the remote collaboration of all clinicians and supported by the respiratory therapist contacted the family's social worker and the parents, namely mother, to establish short-term care goals while the child is admitted, as well as long-term care goals after her discharge from the acute hospital. Most relevant and most used evidence when making decisions regarding the care plan. The authors, Castellani et al., 2018, identify 4 main treatment goals as part of caring for patients with cystic fibrosis. The goals include supplying the adequate nutritional needs, loosening and evacuating of secretions and mucus from the lungs, and prevention of lung infection and intestinal blockage. Caitlin's team successfully incorporated the interventions described. The child was prescribed pancreatic enzymes by mouth to aid with her digestive system to absorb nutrients more efficiently. In addition, high in protein, extra calorie diet with fat-soluble vitamins, as well as Dornase sulfate, which is a cough medicine, have been ordered. These many interventions from the care team are complicated by the patient's young age in view of her not being able to perform half breathing to get rid of the secretions that are collecting in her lungs. The respiratory therapist suggested to use the nebulized aerosol and perform chest physiotherapy to fight the excessive amounts of mucus. The two physicians, Dr. Copeland and Dr. Benjamin, converse with one another to make sure that they're on the same page about the knowledge of the protocol for treatment of cystic fibrosis in pediatric patients, since they're far away from each other. Benefits and strategies to mitigate the challenges of interdisciplinary collaboration to plan care within the context of a remote team. The authors Kamso et al. 2015 state that interprofessional collaboration enhances the quality of care being provided to patients. The Villa Health scenario is an excellent example of collaboration occurring distantly, where the clinicians are working remotely to manage Caitlin's case. The communication among the care team and the child's family is possible owing to the use of modern technologies such as video calling through Skype, text messages, and voice phone calling. The interdisciplinary collaboration allows the care team to exchange their views on the case, offer care proposals, and incorporate skilled practices that adhere to the most recent evidence-based standards of care for the benefit of this specific patient needs and her family. The remote interdisciplinary collaboration in the Villa Health scenario is also addressed by the authors Schmidt and Brown, 2017, describing their approach of open communication and teams' shared decision-making. Such care planning occurred in the scenario with Dr. Copeland coordinated care with other specialists in a tactful, timely, and a respectful way, including the child's family and her primary pediatrician via remote communication. This method of exchanging of health information shows patient-family-centered care, high organizational skills, and results in better outcomes for the child and her family. Thank you for watching.